Hello viewers, and today we are going to talk about how to get the best out of migraine medicines and how to avoid the worst or how to avoid the bad things about the migraine medicines. So first of all, who are the people who require medicines to prevent migraine episodes? So anyone who has more than 3 attacks of headaches in a month and they have tried already all the non-drug measures to reduce the headaches, and despite that they continue to get 4 or more episodes of headache every month, which means weekly once or more. They are the people who need anti-migraine medications. So that is number one. Now if you look at migraine medicines, there are so many of them. So how do we decide which one is good for a specific person? So this depends on multiple factors. Like if suppose somebody is already overweight, then we tend to avoid medicines like sodium valproate or flunarizine, which can cause weight gain. If somebody is, let's say, underweight, then definitely these two drugs can be useful. And in overweight people, topiramate is something which can be useful. Somebody who has migraines as well as sleep disturbance, so they are the people who can benefit with tricyclic antidepressants like amitriptyline or dosulipine or even flunarizine, which can cause sleepiness. And similar, if somebody has a bipolar mood disorder along with migraine, again sodium valproate can be effectively used. And then at the same time, if somebody has certain diseases or conditions, we need to avoid certain medications. So for example, if somebody already has bronchial asthma, then we have to avoid beta blockers like propranolol. Somebody with glaucoma or kidney stones, topiramate should be avoided. And as I already mentioned, those who are overweight, we have to avoid sodium valproate and flunarizine. So these are some of the tips which can be used while selecting anti-migraine drugs. And then one specific situation comes is pregnancy. So the good thing about pregnancy is that migraine attacks tend to come down during pregnancy, so the number of headaches will be much lesser. And for occasional headaches, definitely paracetamol can be used. But if small group of people can have migraine headaches continue during pregnancy also, then there are some safe medications which can be used after consulting the neurologist for that particular patient. So these are the some of the common tips which can be used for patients with migraine. Now the question comes, how long do we need to continue these medications? So as long as the headache frequency remains high like more than 3 times in a month, the medicines need to be continued. It could be few months, and in some cases it could go on for a few years also. But be in the touch with your neurologist who can guide you regarding how long the medicines need to be continued. And also in children also migraine can occur. So there are some good medicines which can be used, like cyproheptadine is effective, propranolol, flunarizine. So some of these drugs are also effective in children. So in consultation with your pediatrician or neurologist, these drugs can be used in children also, because it is childhood migraine is a real thing, it's not unreal, and we see them quite commonly. So I hope you got some good information from this video, and please like it, post your comments, and subscribe to this channel to see more educative videos in the future also.